Whoa, okay. So, Candy, you probably all know Candy. If not, Candy works with the in the community health portion of the Oneida Health Clinic, and of course has been one of our big supporters and one of our champions through the coalition as well. So we are thrilled to have her give a little presentation about breastfeeding and COVID, which I know a lot of you have been involved in the last year. So I am gonna hand it over to Candy.
All right, welcome everybody. Yes, virtual. It actually has been a while. I'm a little nervous. I'm like, geez, I haven't presented in maybe like 3 weeks. So I had to do some research about this. I thought the topic was obviously pertinent and people had questions, and there's tons of obviously facts and myths out there about COVID. And I've had some interesting questions from my clients and at the COVID vaccine clinic. So I just thought I would share what I know. Obviously, it was a learning curve throughout the pandemic as of last March. So I'll just run through a few slides and then we can just do a Q&A at the end. This picture I really liked. I was searching for, I'm like, what do I start with? You know, it's a baby and it's in a little bubble. See that little bubble? You know, like breastfeeding, you're creating that nice little protective bubble for baby, and you can see the virus outside it. So I thought that was really cute. All right, so let's see if how I zoom. What's the, doesn't show on here anymore. There we go. So I thought we start out with reviewing the benefits. Those of you that breastfed probably know, those in the field working with moms, it's just a good reminder of why we are breastfeeding and why to promote it and to why to encourage others. So this is what I included in my slides for my breastfeeding education class. I really like how this is portrayed, how breast milk compared to formula. For years, the formula companies have been trying to reproduce what's in breast milk. I even have a story, a coworker who's almost 60 said her mom would just take that carnation milk or something and put water in it and dilute it, and that would be their like formula. So you can see throughout the years where they're the same, in the blue arrow down, they have about the minerals, vitamins, fat, carbohydrates, protein, and water. So that they're able to replicate and reproduce. And I know when I went shopping for somebody, I had to pick up some kind of formula, and I was just in shock at all this DNA, RA. I was like, what is all of this stuff? Why are they advertising it? And so I think that was the newest component that they were able to replicate in there. But you know, there used to be like 4 or 5 choices, and now there's probably like 40 different type brands and types of formula. But you can see there's 7 additional elements that they were unable to replicate. Breast milk has natural hormones, antibodies, which help babies fight off infections, anti-allergies, anti-parasites, antiviruses, growth factors, and enzymes. So you can see all the 7 above. You can't get anywhere else besides breast milk. So those are some kind of things. Even it was an eye opener for me too, to say, wow, that's, you know, something that I'm providing for my baby that no one else can. And I love this picture. I make milk. What is your superpower? So breastfed babies, we know also, I really like this illustration. And if I was told this after I had my first, I probably would have tried breastfeeding. I went straight to college classes, probably 2 or 3 weeks after I had her. My parents, my mom, my aunts on my mom's side didn't breastfeed. So nobody was really telling me all this. But if they would have said, okay, formula leads to, this is increased risks. So formula increased risks over 200% of respiratory infections and being hospitalized. GI is over 100% more at risk, ear infections, asthma, type 2 diabetes, SIDS, and obesity. So knowing all these things, and this was a really controversy of how to teach breastfeeding. Do we teach it's good, here's the benefits, or do we teach more about the risks of formula? I wish somebody would have told me the risks of formula. So there's another added benefit, is basically your baby's not going to be hospitalized and super, super sick. So On to COVID, just a quick review. We all know it was defined, or it's a disease caused by, it's called the SARS-CoV-2. I have no idea what that means, but that's what the scientists, biologists kind of said, this virus, this is what it is. And then it was known as the coronavirus or disease. So then that came up with the COVID-19. And then it happened, obviously, the pandemic, it was in 2019. Because I was like, where did COVID-19, where did that name come from? Well, it all goes back to its original name and when it started to appear. Symptoms, those of you that had it or know somebody, people can be super sick, and the younger population is just literally like sniffles at times. But I did most of the contact tracing with my coworkers starting in last September. Um, and obviously those that had diabetes, high blood pressure, all of those things got worse. But most of them said there was a period of time that they had a fever, most often a cough, a dry cough, or like they would cough up stuff, shortness of breath, chills, muscle aches, headaches, stomach issues. Now, this was odd. So some people would think like, wait, maybe I just have like the stomach flu, because they would be nauseated. And this actually, some of the cases I had said they had really severe diarrhea, which was really odd for, diarrhea, for stomach issues, and then you have respiratory. So it was really confusing. And then the most obvious one when people usually got tested was, wait a minute, I can't smell or I can't taste what's going on. So that usually brought them in to get tested. So that was the one, like I said, the most prevalent and kind of stood out. But I would check on patients probably midway through when they had the disease. So some of them were already past, like, oh my God, I woke up, I was all sweat. I had the chills, the body aches. It was the worst ever. Some of them described it as like influenza, like the flu. But then later on, like, then they, had some of the GI or the loss of taste or smell. And some of that actually lingered for some people. If you think about loss of taste or smell, it's because of our nerves and everything in our nose. So if those are affected and attacked by a virus, some people said even 2 weeks after they were well, a month after they are well, they still couldn't taste or smell or one or the other. So that was kind of unique about COVID. So unfortunately, paint a picture, of course, for Indian country. Looking at Indian Health Services, so that's the IHS facilities all throughout our country. They had said American Indians' infection rate is over 3.5 times higher. Hospitalization rate is over 4 times higher. So many of our natives are getting much more sicker. Infection meaning they develop pneumonia, and had to be hospitalized, obviously 4 times more. And what that usually led to is I can't breathe. They would go in, your oxygen is supposed to be at 95 and up, and people were like in their 80s. A relative of mine, that was her symptom that kind of threw us off. She was just like, I'm okay. I'm just tired. She could barely walk from bed to kitchen. And we're like, we better check your oxygen. Sure enough, she was like 89. So that's what's taken people to the hospital, because at least they kind of know that it's not right. But then that's also, taking people off this earth, because they just think, I'm just tired. I'm just, fatigued. This has really gotten me burnt out. So I was really spreading education for the people in my community, is like, check oxygen levels. There was a thing on your phone where you actually could check your oxygen if you had, I believe, an Android phone, or you could get a contraption to put to an iPhone to check your oxygen level, because that's what was really taking people out, was lower oxygen. Our body just can't survive without it. Department of Health Services. Now, these are kind of the experts within our state. You'll hear DHS all the time, like DHS. They have trainings. They're the ones that the governor works with and gave all the educational alerts. But the death rate for American Indians is 1.5 times greater. And you can see here, American Indians were like the smallest population, of course. We're about 1% nationwide. Percent of COVID deaths, and then deaths per 100,000. So even though we're small, it's taken, a big part of our community. So treatments, if you haven't heard, there is basically no cure. So there's no medicine. And right now we obviously have the vaccine, but There's no cure. Home remedies, when I would talk to clients that had COVID, I'd be, telling them Tylenol. People were turning to herbal teas, things like that, just for comfort measures. But if it was severe and hospitalization was needed, they usually would get the combination of oxygen, an antiviral med, which looks just like that. It's like a capsule, and then a plasma transfusion. Now, it's kind of interesting. Plasma is actually, you take from a person that had COVID, the plasma or the antibodies are kind of taken out of that blood. And then this is kind of what it looks like. And then the plasma is transfused to kind of help that person fight off the infection. So most people that I know that were hospitalized did get kind of this triple treatment: oxygen, antiviral, plasma transfusions for like 3 to 5 days continually until some of the symptoms subside, or basically until they could survive without oxygen. The vaccines, a lot of questions about these. It's kind of interesting in the beginning when we start having the COVID vaccine clinics, people would just kind of, come in and ask a few questions, but then as you got a month or two into it, they ask, what kind is this? What's the name of this one? Which was good. You want to know what type of vaccine you're getting. There's the Moderna, Pfizer, and then the newest one is the J&J, which is Johnson & Johnson, or another term they call it is Janssen, just basically who made it. So all of these have different stipulations. We started out with Moderna. We gave Moderna across the board through the mass clinics here in Oneida. And those are 2 doses, 28 days apart, 94% effective. So we felt good about that. We're telling people this is the Moderna vaccine. You're going to come back in 28 days. And after 2 weeks after your second, you'll be 94%, protected against COVID. And a lot of people were really grateful and kind of felt secure. It was almost like a celebration for them after that second one. Like, I'm so relieved, just kind of knowing the numbers and the effectiveness. Pfizer, this is the one that lowered to over age 12. So this is where our newer clinics, we had to ask other clinics for medication or for the vaccines, because each clinic is we're given what we're given. And we received the Moderna. And then there's this portal we go to see if any other clinics have extra, and some had the Pfizer. And as a nation, they wanted that coverage for 12 and over. So we were directed to find the Pfizer. We got some. Once again, that's 2 doses, but 21 days apart. Once again, around 94% effective. So when we got the Pfizer, we started to go to the Oneida Turtle School, just for kind of a safer environment, kind of, instead of the big, huge mass clinics, we were in just 2 small art rooms, and kind of, guided the students through and talked with the parents because everybody was a little nervous. So, but that went over really well. We had most of our clinics at Turtle School fully booked, and we had walk-ins. So many received that Pfizer vaccine. Johnson & Johnson, we did not have. We were looking for some. There was a stop in manufacture. There was a delay in it. And everybody kind of heard about the blood clot side effect, which they had said was not related. But the clinic, the medical clinic, if you go in for an appointment, say you have a well exam or you're seen for a follow-up, they'll ask you if you want the J&J. That's 1 dose. You get it that day, and then you'd be covered 66%. So that is available, but it is hard for us to obtain right now. But just kind of given community options for which vaccine they would like to receive. So we go on to pregnancy. So during COVID, March of 2020, I had just closed a couple of my cases, which means they delivered, I was found on postpartum, and then that was probably the next couple of months from that March to May that I would start getting new clients, but I didn't. Everybody was really just reaching out. I mean, we were seeing well moms at the clinic, but everybody at that time was kind of in, stress response, kind of, basic needs like, okay, I lost my job, I lost my house, all those types of things. So my job for the first 6 months basically was providing resources and support for moms by phone, or I would go to the clinic. And I found a lot of women in need of lactation support, which was really nice because I'm a CLC. So I'd be able to go over to the clinic and help them. But we still don't know much about the risks of COVID being passed to babies from moms with COVID. Obviously, that's a population that, is not studied or basically last on the list. Um, COVID is uncommon in newborns whose moms had it during pregnancy. So, a pregnant woman, you're ill, you have COVID, you tested positive, the chances that baby, the fetus inside you, will not get COVID. They did find some newborns did test positive after birth, but it was really hard to detect. Did they get it before, which is unlikely, or during, during delivery, or like after? Was it, feeding without protection? So you can tell that's a really hard area to cover, just a lot of different time frames to study. Most newborns who tested positive had mild or no symptoms and recovered quickly. There is that rare circumstance where some babies were developing severe symptoms, but majority that I heard of, if I call the household of 5 and they said, well, what about my baby? Baby probably had it if they're in the house with everybody else that had it. And then I would just kind of ask about symptoms, and hardly any had fevers. It was more like a little cold. But babies hopefully, if they were breastfed, got some of the antibodies and were able to fight it off and just have a real mild illness. So this was my life was living by all of these different 4 professional organizations. So once COVID hit, I'm like, oh my God, what am I going to tell my pregnant moms? What am I going to tell my breastfeeding moms? And people in the prenatal OB world, we live by ACOG. These group of people, they're obstetrics and gynecology experts. So they were telling us stuff. CDC was telling us stuff. AAP was telling us stuff, and WHO, which is World Health Organization. I attended so many webinars and teleconferences and everything to get the most updated information, kind of turn it around, make a summary, and offer it to the community and to my moms. And it changed anywhere from we're a full year cycle now. So it changed almost every other month. Tell your moms this, tell your moms that. Well, we think this, but wait, we have to study that. So it was a really trying time. But in the end, probably a couple of months now, all of these basically said most information shows that it is safe to breastfeed, even if mom has active COVID. It's not likely that COVID can pass through breast milk and infect baby. CDC said current evidence suggests that breast milk is not likely to pass COVID to babies. The AAP, which is all the pediatricians, strongly support breastfeeding as the best choice for infant feeding, even if mom or baby has COVID. And then the World Health Organization recommends that mothers with COVID should be encouraged to start or continue breastfeeding. Mothers should be counseled that the benefits basically outweigh the potential risks. So thank goodness everybody came to the same conclusion. But between March and probably the 6 months after that, they all differed. Mainly the pediatricians were saying stop breastfeeding. World Health, had to deal with all different women across the country in different countries. They were kind of at a controversy as far as is it really safe or not. But ACOG, CDC, we stuck by that. And then all these nice infographics came out supporting moms. Yes, do skin to skin. There's so many more benefits. Yes, breastfeed if you don't actively have any symptoms. And then if you do, let's talk about some precautions. But overall, in the beginning, it was always weigh the pros and cons, talk with your provider, and make a good decision, or the best decision for you and me. So what we've seen kind of roll out from all that breastfeeding after delivery. So in 2020, like I said, this was the beginning of the pandemic, and recommendations were reactive. That's the best term for it, and not really evidence-based. It was just, we got to set something in place. Moms are contagious. We don't want them to get babies sick. It was really reactive. And unfortunately, there was probably a lot of women that dealt with and are still dealing with trauma of baby being taken away. So reactive things were separation of mom and baby. They literally, mom was known to have COVID, they would take baby out of the room to the nursery, no skin to skin, no breastfeeding. they also, which was, we want to kind of laugh about it. We're like, who thought of this? But they recommended breast or skin hygiene in one of the webinars that I attended. And all the lactation experts came about and said, no way. Our bodies, our breasts make all these protective oils and have these smells for baby to successfully latch and for mom and baby to bond. Instead, they were having moms, wipe themselves down before they nursed, which was totally unnecessary. So you can see some of the moms that in the beginning of the pandemic that were had forced removal of their babies or told, to do, like I said, not evidence-based practice, really suffered. And unfortunately, we were able, well, fortunately or unfortunately, able to learn from them. So fast forward, like I said, after a little bit more data and research was done, now basically we're saying there's more benefits than risks. So yes, let's breastfeed. Um, Now they're saying that breast milk actually has antibodies in it. They've studied it. Take a mom with COVID, look at the breast milk, you know, liquid gold, have a cold, a mom has a cold, there she's creating antibodies within her so baby doesn't get it or that baby doesn't get it as bad. Same thing with COVID. And then they were saying if mom was severely ill, which makes sense. What if you're actively coughing? What if mom is on oxygen? Is that mom able to pump? And then you go through the precautions of safely pumping and then feeding baby breast milk or having somebody else feed. So there's always look at the circumstances. What are some steps we can take? Just taking case by case and including mom, because I think in the beginning, moms weren't included. And I think they were unprepared. I know a client of mine, she was at St. Vincent's, and I asked her how her delivery went, and she was like, I was shoved to a side. I was shoved to a side room. I wasn't even in the labor and delivery unit. They put me in the postpartum unit way at the end of the room. And she had had COVID, say in March. And then she delivered 4 or 5 months later, and you still can test positive. So her on admission, she tested positive, but she had no symptoms at all. But because she tested positive, she was put off to the side. She said, nobody hardly came by me because I was way off, and it took them a long time. So unfortunately, her birth experience was altered, and they still do testing, but now we know you can test positive for quite some time. And if you don't have symptoms, like now, if she went, she'd have skin to skin, she'd be able to breastfeed. And I think she'd be allowed on the unit if she was masked. So it's not unfortunate. Um, when I was talking about WHO or the World Health Organization, in 2020, most other countries still recommended to avoid direct breastfeeding if mom had COVID and to isolate baby. The ones I read in an article were China and Switzerland. So they just like, I don't want, this is the only way to stop the spread. That's what people were telling them. So they continued to separate moms and babies, which is unfortunate. So helpful tips for avoid passing COVID. So if you have a mom who has active COVID, obviously, if she's still able to nurse, it's common sense. Wear a mask, wash your hands, and then if severely ill, can mom pump and then provide baby with milk. So it just comes down to what we're all telling our kids and telling people to do is wash hands, mask, but still be able to breastfeed. Pumping, I just wanted to include this. A lot of times, pumping really isn't reviewed. So I would get questions after the fact if mom was ill or, say if it was due to something else, she would pump most immediately within that week, not know how to use it. So I found myself during COVID really walking through and showing moms what a pump looks like, what a phalange, which down here is assess the fit of the phalange. A lot of people didn't know. So they were, nursing okay, turned to pumping, and then their milk supply went down. So then I had to go over, look at the phalange. You can order a different size, look at your pump, so really getting familiar with the pump and how to correctly use it is really important. And they're saying if you're unable to pump, is there pasteurized donor milk near you? one of our hospitals do it, and there is a website that I want to call it, I think it's Great Lakes. They do have breast milk that's pasteurized and they do sell it. Or I know there's community groups that have a personal stored milk and share with other women. So I included just the pump videos. It's really important because nobody really walks you through that postpartum. But it is important to know what kind you have, how to use it, if it fits appropriately, and a big thing is how to store it. You do not want to waste that liquid gold. So overall, basically, here's baby fighting off COVID. If you bring home a brand new baby, same thing, obvious, limit visitors. I know everybody wants to see baby. When you're in a hospital, you have baby, you're only allowed that one support person still. And I was asking, I had to observe a couple of labors at St. Vincent's, and I was asking them about it. And then she was like, oh, it's kind of 50-50. Some feel really bad. I want mom, grandma, dad, or some, other people there. And we know Native people like to bring, all their, their extended family with them. But some of them were saying, the couples were like, I'm kind of glad it's restricted. Now I don't have to, have everybody and anybody in my room. So some of them did like the privacy. And, like for our family, we would have been really sad, just like Lacey's mom that couldn't come to the delivery. I don't know. I think I would have said had a ladder or put on scrubs and roamed around or did something creative to be in that room. So once you get home, it's okay to ask those questions like, are you vaccinated? Have you been around anybody? It's typical and okay to ask those questions, or just, be alone for a week and see how it goes. Keep distance with people who are not in your household, or ask if they're ill, and know the symptoms. So basically, babies with medical conditions or preterm seem to exhibit more severe symptoms. So if you have that tiny baby that came too soon, really keep an eye on him or her, looking for that fever, kind of fatigue, don't want to eat, runny nose, cough. I think the poor feeding and sleepy is the most that you would be concerned about, because then obviously dehydration would be a concern, but just keeping an eye on baby and, checking in with your pediatrician if needed. Oh, that is it in a nutshell. It is just basic information. What is COVID? Pregnancy and COVID, breastfeeding and COVID, and then when you and baby are home. I just like to share, this is my breastfeeding group. Sunshine Nunez and them have this logo, which we still need to do something with. And Sherry, we're still waiting for another pizza and pictures. These are all throughout the tribe. Everybody just loves them. So thank you for joining me, and thank you for Glitzy for having these educational sessions. And I'll just open it up for questions, comments, or tell me some stories about you and COVID.
Thank you, Candy. Yeah, anyone who has questions, you can either do the chat, we will monitor that, or if you are able to just take your microphone off mute and ask questions away. I see there was something in the chat. I think Sunshine was just making a comment, but I'm not exactly sure what that was connected to. So I don't know if you had anything more you wanted to say about that, Sunshine.
Oh, yeah. Hi, everyone. My comment was just towards Candy when you were referencing your coworker saying that they used to mix the carnation milk and the water.
Yeah.
My mother-in-law had just mentioned that like the other day, that's what they used to use for their formula back in the day as well. And I just thought that was crazy to hear, but I also understand that you do what you got to do. And I mean, lack of information and knowledge, obviously, but
Mhm.
that it worked for the most part. So, I mean, I obviously don't encourage it now, but it was just funny to hear.
Yeah, I think it would be like child abuse now. Feed your
I have
baby
an
carnation.
older coworker whose mom used like the powdered milk and water for her.
Powdered milk. Oh yeah.
Yeah.
That's
So
interesting because at the start of COVID, there was a whole bunch of information coming out on Facebook and other social media about how to make your own formula. So there was then a lot of pushback from USDA and other, health, child health prevention things like, no, don't do this. This is not right. Don't do it. So and that was, of course, now over a year ago, but there was just that in that first initial scary phase where people were trying to stock up and things and they didn't find what they needed. And so that was part of the whole, one of the things we had to kind of fight against was, no, you don't need to make your own formula.
I did not hear that one. I had heard more the opposite twist where it's something like in natural disaster, this is a good time to really enforce, you would be set if you're breastfeeding in any natural disaster kind of thing. And then at USBC too, they had talked about like the shortage, and there was a lady, she was a Hispanic lady, and she had said she was going out to make sure, all the babies had food and women were donating their milk, and you don't really think about that.
I thought your slide about the hospital practices, that was really interesting to see because like you said, it was all very reactionary.
Yes.
And just trying to put something in place. I did not realize that was the extent to how things had gone. So that was really interesting to see.
Yeah, some of the webinars, like I said, like the AAP, like the pediatricians they're not lactation experts. And then they were, usually kind of given, I guess, recommendations, and everybody was like, okay, tell me what we should do. And yeah, that breast hygiene had all the lactation people just cracking up. They're like, what? You want us to rub our breasts? What? No. So then they had to take a step back, kind of think, why can't we do that? The glands, the scent, everything like that. I mean, then it made sense,
Candy, this is Linda. Can I ask you, are you seeing anything with the new Delta variant they're talking about?
You mean the strain of COVID?
Yeah.
Yeah, we haven't had any incidences here. Like I said, we get all our information from DHS, and it's just kind of been a side note, like other states or countries have had it, but we haven't.
You
It's
haven't
not
seen
something-
anything, right?
No.
Okay. Because they're saying that one is so much more contagious. I
Mhm.
don't know if it's in our state at all, or have you heard if it's in our state at all, Candy?
I don't recall.
Yeah, I don't either. Okay. Just wondering.
Yeah, I had to learn a lot in the beginning. I was, like I said, March to September, I was basically doing my own thing, and then our numbers increased. So then I was trained in WEDS. I had to do contact tracing. I was in a DHS meetings, and then before I know it's December and we're doing vaccinations, and yeah, it's so fast paced. I feel like I've been on a roller coaster. It's just, I can't believe it's July.
I can't even imagine. There was so many unknowns in the beginning, and everything you had to learn, and not to mention things you had to tell your moms. It's like, okay, what's going on? It had been crazy for you guys.
Yeah, it was like,
Wow.
you wear so many hats, and then it was,
Yeah.
you have to, it's not my specialty. I mean, even the nurses I work
Right.
with are public health nurses. I mean,
Sure.
they're in the communicable disease area, but I mean, it was quite
Right.
the learning curve.
Exactly.
I had notes all over the place. Yeah.
Right.
There was one interesting question at one of the vaccine clinics a mom had, which I was like, good question. She had said, I'm breastfeeding. Is it okay to get the vaccine? And we're like, yeah, pregnancy, breastfeeding mom, you're able to get it. I said, what is your concern? And she's like, well, what if I get soreness in the arm and fatigue and all those side effects? Will my baby get those side effects? I was like, good question.
Interesting.
You know what I mean? Yeah. And I
Yeah.
was like, no, it's gonna be you. It's going into your body. So it'll be your side effects, and baby will just get some of that immunity that the vaccine gives you. So,
Right.
but I was like, good question, I told her.
Yeah, no kidding. Crazy stuff.
Yeah.
Wow. So you're still doing a lot of vaccines?
Yep. The Pfizer seems to be the one. We've been, like I said, we get Moderna, we get Pfizer. But now we have, and I don't know if any other tribes are doing like an incentive program for the
Okay.
vaccines. So we're thinking we'll get a flood of people. I mean, it was slowing down for a while. We were able to close down our mass clinics. I mean, we did 200 to 300 at a shot at the United Turtle School. And then it kind of got smaller, smaller, went back to the clinic, went back to the school, to the smaller ones for the students. So we're hoping we can maintain it because we only can do about 50 tops at the clinic. But if there's a big surge, we might have to do mass again. But we had a pretty good rate. I mean, we have about 2,000 staff, and we're going to the casino to do 2 clinics, and we're going to be over 50% vaccinated as Oneida Nation staff.
And have you seen any side effects from the vaccine itself?
Nope, just besides the common, my
Just
arm
the
hurts.
sore. Yeah. Good.
Yeah.
That's great.
Any other questions? Okay, not seeing anything or hearing anything. Just some kudos to you, Candy. I also wanted to see, Candy, is there anything else you're doing in the future for people? I know you had done a couple of talks about for USBC about trauma. Did you have another one coming up?
USBC, I'm done. That we did trauma and breastfeeding and quick ideas for breastfeeding coalitions. But from that, because we didn't feel the trauma one, we didn't care for how it was presented. You know, we had like 3 Native people on the committee, but we did more of a general information session. And when we talked with the head of USBC, because Cami and Kim were advocating for us that more Indigenous sessions need to be done. And so we actually met with the head lady, I forget her name, but she wanted to, once they get done with all these TA sessions, she wanted to reach out and see if we're interested in doing something specific about Native American or Indigenous trauma and breastfeeding and pregnancy. So hopefully that'll come to be everything with like historical
Awesome.
trauma and
And there's been a lot of interest, I know, with the Native Breastfeeding Week coming up. We are getting a lot of contacts from people who are just wanting to promote it or somehow have a connection to it or be able to understand it, I guess, a little bit more. So I think that's really going to be something more of, or hopefully see more of. So
yeah, and then our clinic here, we have strategic planning, and I'm on the committee where we want to introduce trauma-informed care practices or policies at the clinic. And I'm not sure if any other tribe does it. I know Menominee went through intensive training. It was throughout the tribe, but we start through our community health department first. So we're kind of attending trainings, gathering resources, and seeing if we can, in the end game, we basically want trauma-informed care training mandated annually, which would include historical trauma.
excellent. I know DHS is pushing a little bit of that too with a lot of the programs we work with too. So I think that a lot more will be coming on that, hopefully. I wanted to mention too, we've got another session in a couple weeks. So if you're interested, this one will be about learning about growth charts. And I think a lot of times we're seeing it's hard to compare our kids. We see a little bigger kid and we think there's something wrong with ours, but ours is perfectly healthy. So just an opportunity for you to learn about that, or definitely share with your participants this opportunity to learn about how to interpret growth charts for yourself. And then of course in August, it's breastfeeding month. So we will be having a little bit more focus on breastfeeding, and specifically with Native Breastfeeding Week, the 2nd week of the month. And I know a lot of us are planning some events. In Oneida, Candy and Sunshine are doing a very unique twist on doing a ribbon skirt with the breastfeeding logo. So we're really excited to see how that works. And then also the virtual latch is that the 10th? 11th, I
I'll
believe.
say 11th, Wednesday.
Yeah. And I know you guys are doing your own event as well, or a separate event to kind of tie in with that. So we're really excited about some of those events coming up. So yeah, keep in touch with us and look for things happening. If there's any questions or concerns that you have after the session, feel free to reach out. But again, I just wanted to thank Candy. It was just, we all lived through it, but there's just some kind of, looking back at some of the things, it's kind of amazing to see or to remember all that. So thank you again, Candy. And thank you for all the work you've done throughout. I know that you've still been plugging away with breastfeeding as well as Sunshine. So we appreciate that effort as well.
Thanks for having me. You guys are doing great.
Chance, anyone have any last questions, comments, concerns? Okay, no, looks good. Thank you again, Candy. Like I said, really appreciate it. And hopefully we'll see everyone in a couple weeks. Have a great day.
Hi, Lacey. Tell Joseph I said hi.